Hello everyone, I am Dr. Shankar Dey. Now I am going to discuss INICET 2022 May session recall based question. So let's start with today's discussion. So question number 1, a 48 years old male coming with fever for last 3 weeks. So fever for last 3 weeks, anti-malarial and antibiotics given, but there was no response following adding antibiotics and anti-malarial. Abdominal distension was there, and especially this antigen RK39 antigen test was positive. So these clinical features, fever, abdominal distension with RK39 antigen test positivity, diagnose the case with visceral leishmaniasis or Kala Azar. So this Kala Azar can present with various signs and symptoms like fever, hyperpigmentation or blackish discoloration of skin, hepatosplenomegaly or abdominal distension. So abdominal distension was because of hepatosplenomegaly. So this is the usual presentation, and blood pictures usually shows pancytopenia, decreased RBC WBC platelet series. In laboratory diagnosis, this will help. You will find LD bodies in the macrophages with Zimsa stain and Leishmania stain. So this is very important image based question. Kindly follow the image of LD bodies in macrophages. This is very important, can be asked in the upcoming exam. Culture media for Leishmania is NNN media. Serology tests like Napier's aldehyde test, Chopra's antimony test will be helpful to diagnose. RK39 antigen test through ELISA or immunochromatography is positive in cases of visceral leishmaniasis, and the treatment, that is drug of choice for leishmania, is amphotericin B, liposomal amphotericin B, and other drug that can be used oral miltefosine, antimony compound like sodium stevogluconate, pentamidine, paramomycin or sitamaquine. So these are the test, clinical features and treatment protocol. Another important test, Montenegro test or leishmanian skin test, is also done in case of leishmania. So in this question, the question was asked is what will be your management. So in this case, my management will be with amphotericin B. So this is the answer, amphotericin B for visceral leishmaniasis or Kala Azar. Coming to question number 2, what is the IOC for the disease? One image was given. As you can see, this was clear image of bird beak sign. So this is nothing but bird beak sign suggestive of achalasia cardia. So this was a case of achalasia cardia. And what is the investigation of choice for achalasia cardia? It's nothing but manometry. Is manometry. So sorry, it's manometry. So investigation of choice is manometry, not 24 hours pH monitoring. It is for GERD, not endoscopy or CECT, contrast CT scan. It is manometry to record the pressure at the level of lower esophageal sphincter. So this was image of achalasia cardia showing bird beak sign in barium swallow study. Coming to question number 3, which of the following is not a first line drug for rheumatoid arthritis? Among the options, the answer will be azathioprine, and HCQ, methotrexate and sulfasalazine. These are the first line drug for rheumatoid arthritis, but not azathioprine. Coming to question number 4, volume of prostate gland. So normal volume of prostate gland is near about 20 to 40 cc. So among the options given, nearest and best option for this question is 20 cc. So volume of prostate gland is 20 cc. Coming to question number 5, which of the following is active metabolite of cyclophosphamide? So active is, as you all of you know, cyclophosphamide, this is a prodrug. So cyclophosphamide is a prodrug. This is activated in liver, and this activation produces the active metabolite 4-hydroxycyclophosphamide. So this is the answer, 4-hydroxycyclophosphamide is the active metabolite of the prodrug cyclophosphamide. And related to cyclophosphamide, certain things are very important that can be asked in upcoming exam, like what is the one of the important side effect of cyclophosphamide, that is hemorrhagic cystitis. So this cytotoxic drug can cause the side effect hemorrhagic cystitis. So kindly remember this, because this can be asked in the upcoming exam. Hemorrhagic cystitis is one of the common complication following cyclophosphamide administration. This is because of the cytotoxic effect of the phosphoramide mustard. And what is the prevention of this hemorrhagic cystitis caused by cyclophosphamide? To prevent hemorrhagic cystitis, what we have to do to prevent this hemorrhagic cystitis, we have to hydrate the patient adequately. So adequate hydration and co-administration of mesna. So adequate hydration and co-administration of mesna, also known as 2-mercaptoethane sulfonate. Mesna or 2-mercaptoethane sulfonate can reduce the chances of hemorrhagic cystitis. This cyclophosphamide is used mainly in treatment of lymphoma, chronic lymphocytic leukemia, breast cancer, also in some cases of nephrotic syndrome, rheumatoid arthritis, also to treat the graft rejection during organ transplantation. So this is about cyclophosphamide. Next, coming to the question number 6, this type of image was given, not the similar image, slightly different, but the image was suggestive of hydatid cyst. So this is kidney, as you can see, this is left kidney, this is right kidney. So this is image of hydatid cyst of kidney. So you have to choose the incorrect statement or wrong statement about the hydatid cyst of kidney. So leakage of cyst can cause anaphylaxis or allergic reaction. Yes, this is true, because leakage of the hydatid fluid can cause anaphylaxis or allergic reaction. As all of you know, this is a basis for Cazonis test. Hydatid fluid can cause anaphylaxis or hypersensitivity reaction. This is a basis for Cazonis test. FNAC and biopsy required before surgery. This is the false statement. So this is one of the answer. FNAC and biopsy is required. This is not required. So this is false statement or wrong statement. Albendazole is used for medical treatment. This is also right statement or true statement. Caused by dog tapeworm, absolutely true. This is caused by dog tapeworm, also known as Echinococcus granulosa. So the wrong statement is FNAC or biopsy required before surgery. So hydatid cyst caused by dog tapeworm or Echinococcus granulosa, definitive host for this is dog and dead end host is the man. So definitive host, this is also important question. Definitive host is dog. Hydatid cyst, most common site is liver. Second most common site is the lung. Cazonis test is related to this hydatid cyst. What is the treatment? Pair approach, and for medical treatment you can use albendazole. And this is the hydatid cyst with 3 layers. This A is ectocyst, this B is endocyst, this C is endocyst, B is ectocyst, A is pericyst. So from inner to outer, endocyst, ectocyst, pericyst. This is D is brood capsule. This D is brood capsule, and this E is daughter cyst. So this is 3 layers of cyst with brood capsule and daughter cyst. This is the image of hydatid cyst, microscopic image. So this is the CT scan image of hydatid cyst of the kidney, and this is the wrong statement. Coming to question number 7, which disease screening is not done during donor blood screening according to government protocol? Screening for dengue is not done during donor blood screening. Rest is done, like malaria test is done. HIV, hepatitis B, C is done. Like mandatory screening test for donor blood, like number 1 is HIV, human immunodeficiency virus, hepatitis B virus, hepatitis C virus, syphilis and malaria. So these are mandatory tests for screening of blood, but dengue is not mandatory screening test during donor blood screening. Coming to question number 8, what are the structures in cubital fossa from medial to lateral? As you know the very popular mnemonic MBBS. What is the mnemonic? MBBS. M stands for median nerve. So first medial to lateral is MBBS, medial to lateral. So the structures first is median nerve. So first the option C will come, first median nerve, then B is for brachial artery, then option A will come, then biceps brachitendon, so then option D will come, then S for superficial branch of radial nerve, so then option B will come. So medial to lateral is CADB, like this medially. So look at this image carefully. Medially, this medially is median nerve, most medially, then this is brachial artery, then this is biceps brachitendon, and lastly this is radial nerve, superficial branch of radial nerve. This is pronator teres muscle, this is pronator teres, and this is brachioradialis. So this is contents of cubital fossa from medial to lateral. Very important question. Next, coming to another question for pharmacology. Paracetamol 500 milligram written on the label of a tablet, but a government analyst found that it contains only 200 milligram paracetamol. So label is written as 500 milligram, but it contains only 200 milligram, means the actual drug content is low. So as per Drug and Cosmetic Act, this is example of nothing but misbranded drug. So this is misbranded drug. As you all know, misbranded drug, when the misbranded drug, if it is so colored, coated or powdered or polished that damage is concealed, when the damage of the medicine is concealed, or it is made to appear better or greater therapeutic value than really it is. So this was the question. It is appeared to better or greater therapeutic than really it is. So it was appeared to be 500 milligram, but it is 200. So this was the example of misbranded drugs. Okay, so this was example of misbranded drug. Next, coming to question number 10, which anti-diabetic agent can cause bone fracture in female? This is canagliflozin or SGLT2 inhibitors. So common side effect of SGLT2 inhibitors like UTI, urinary tract infection, or urosepsis because of osmotic diuresis, bone fracture. Sometimes this is also seen in some cases, amputations of leg and foot, dehydration, decay, diabetic ketoacidosis, AKI, acute kidney injury, and hypotension. So these are the common side effect of SG2 inhibitor. Importantly, UTI, urosepsis, very common following SG2LT inhibitor use. So I have discussed question number 1 to 2. In the next segment video, I am going to discuss question number 11 to 20 very soon. So stay tuned for the next video, and don't forget to subscribe the channel Dr. Shankar Dey. So share the video with your friends, juniors and seniors. Thank you very much for watching this video. Thank you.